think a few. We are going to be recording this meeting for folks who aren't able to attend. We also have closed captioning available. So my name is Kristen Don Hefner, and I think I have spoken with many of you over the course of your negotiations. I work here at the Oregon Health Authority on the Measure 110 team. And now that we have successfully negotiated everyone's contracts and started getting money out the door to all of you, my role will be, excuse me, changing a little bit to helping support all of you get these burns up and running and kind of everything else. So we have a few slides today to share. So I'm going to go ahead and start sharing my slides there. I know many of you have been in our presentations before, but if you wouldn't mind changing your Zoom name to include your pronouns should you wish, and more importantly, your organization, that would be great, just so we remember who you all are with. It was easy to keep track of a few people in the beginning, but now there are a lot of you. This is really exciting. So that would help us out. And to do that, you just click your little participant button at the bottom and kind of toggle over to rename, and then change however you would like the name to be formatted. We do have everyone on mute, but if you have questions that come up through the course of this presentation, just go ahead and pop those into the chat at the bottom of your screens, and we'll pause throughout to try to be able to answer some of those. If there are questions that we're not able to answer, we will add them to our ever-growing list of FAQs that will make sure that we update and get posted to our Measure 110 website. So with that, welcome to our third and final burn kickoff meeting. We've had a couple before, but I think by now, since we funded everyone and have had everyone's grant agreements at least sent to you, we are able to make sure that we have everyone, at least given everyone the opportunity to attend one of these meetings. We've kind of had them on a rolling basis. So know that if you haven't been invited to a previous meeting, the information that we're sharing today is all the same that was at the other two. And we really just did that to be able to break folks into both smaller groups and to make sure that you had your grant agreement kind of finished or near finished in some cases before accepting this invite, so as to not overwhelm everyone with meetings in the chaos that was kind of the negotiation process. So we're really excited to have all of you joining us. I know I've tried to express my appreciation to all of you throughout the past several weeks and months for just sticking with us as we are really building this new program together. It is brand new and slightly different way of doing things. And so we just really appreciate the grace that you have all given us and sticking with us as we try to get questions answered in real time to questions that either haven't come up before or that we haven't thought about before. It's been really fun to co-learn and co-create alongside all of you. So today we are going to just briefly touch on the Measure 110 program. We're going to review some of the grant agreement milestones, discuss a little bit about some of the milestones we'll be tracking, briefly review the statutes and regulations that govern all the work that you do, briefly touch on the recurring meeting schedule going forward, and then share some resources. We do have a copy of these slides available, and we'll make sure that we send it out to everyone at the end of this. If you haven't already gotten them, I think they might also be posted to our website. So we're all here to participate in Measure 110. I know you've all heard me say it before, but the purpose of Measure 110 is really to make health assessment, treatment, and recovery services for drug addiction available to all those who need and want access to those services, and to adopt a health approach to drug addiction by removing criminal penalties for low-level drug possession. And I say that just to kind of take a step back amongst all of the moving pieces and kind of fervor over getting our burns up and running, to remember kind of why we're all here. I have to do that to myself several times a week just to not get kind of swept up in all the details. And it's really exciting to be part of such a novel, new once in a nation, once in a generation opportunity. But there are, of course, a lot of nuts and bolts that we can get caught up in. And so we are going to review some of those milestones that are in the grant agreements that you have all received and that most of you have signed. So we believe that to ensure a strong partnership and successful burn activities, we will be here to provide ongoing programmatic support. We are slowly building our Measure 110 team. Full disclosure, it feels like there are 5 people here. In reality, there are a lot of people here behind the scenes that I'm so appreciative of, but there still are not enough of us to really be able to give a lot of really individualized attention quite yet, but that is our goal, and we will get there over the next few months. So we are still in this kind of in between, I would say, bird startup and program support stage, kind of depending on when you might have been funded by the Oversight and Accountability Council. So in this kind of early startup stage, we are holding weekly support space to engage with new burns, and that includes many of you through our TA sessions. We're also processing the initial funds disbursement. I know we have sent out a lot of funding, and we are still waiting on MOUs and signed grant agreements for a few partners. Once we do have your signed grant agreement and a signed MOU for all of the partners within your county, we authorize payment within 20 days, and usually a lot sooner than that. And once that payment gets authorized, there's a little bit of lag between us sending funding out and the bank picking it up, but it's become a much smoother process over time. We also will be providing kind of regular communication regarding submitting your grant agreement. If I haven't pestered you yet, that means you've probably signed your grant agreement, but just making sure that we get all of those back from you so that we can initiate payment. We also have, I think, been providing some information around agreement milestone submissions, what you have to submit when, such as your certificate of insurance, we'll talk about policies and procedures and those kinds of things. We have started an ongoing frequently asked questions document that is posted on our website, and maybe Sydney can also put that link in the chat for us. And that FAQ document gets updated regularly. I want to say almost weekly at this point. The Spanish translation, there's a little bit of a lag just to allow for that translation to happen. And that is updated regularly. We've also shared some initial fiscal reporting information and data reporting information at some of our the past 2 TA sessions. So some of you I know may have gone to that, and now you're seeing the kickoff, so it's kind of all coming together. And sharing that information so you know what you have to report for kind of this first quarter, July 1 through September 30th, recognizing that some of that information might be pretty lean since this is just getting started, but then really kind of planning ahead for the next quarter, which is October through December. From here, we're kind of going to phase into a program support step where we're going to start initiating program monitoring to make sure that we are getting you the information that you need, and vice versa, so that we can make sure that we are able to start tracking your performance and spending. We'll also receive those first data reports and financial reports and be able to dive into those. And we'll also be adding some performance reviews just to address some other indicators that I think we're all interested in seeing to ensure that these burns really are serving their intended audience and meeting some of these early goals. After that, we're hopefully going to shift into a program maintenance phase, where we will continue to have those quarterly fiscal and data reports, but also to just kind of provide ongoing support. Our goal isn't to just fund everyone and then drop off the radar. We really want to build a structure where we continue to co-learn and co-collaborate with you all. So a few of those milestones that I believe have been either previously sent out or communicated. We have, first of all, your memorandum of understanding, which is that document that states how all of you are going to work together to address referrals and form a burn in your region. I believe we have those back from almost everybody. And I know that the few that are left are working diligently on finishing those and getting everyone to sign off. Your grant agreement also requires formalized policies and procedures to address about 12 areas, a variety of topics. That piece we'll get to in a moment, but it is kind of on hold until we actually can provide you with policies and procedures templates, which we have not done yet. So that piece is a little bit a ways out still. We also have data reporting. We had a TA session last week that I know several of you attended to start to share some of the data reporting requirements for phase 1. I know there was a lot of good conversation in the chat that happened about some of the parameters of that data reporting and who you are reporting on, and we are working to finalize some FAQs specifically around data submission, in addition to finalizing the data reporting template and online tool. And then finally, there is a fiscal reporting element, which requires quarterly reports on your expenditures. And I believe we shared that 2 weeks ago in a TA session, and have sent out some subsequent information around that since. And this is just a reminder of the grant agreement, the certificate of insurance, and the memorandum of understanding that are all due kind of on the front end before you get to the data reporting and the policies and procedures. Like I said, I think we have signatures from almost everyone on those grant agreements and memorandums of understanding. So I'm gonna pause there to see if there are any questions in the chat regarding some of these early submissions and milestones. And Sydney, if you have any of those for me.
Hi, sorry, we're dealing with a little bit of technical difficulty. I did put in the chat that we do not have the live stream available today, and your team is welcome to join the Zoom meeting if you had people waiting on that. We very much apologize for that last minute change. There are some questions though, Kristen. The first one I did answer in the chat. Does the FAQ include questions and answers from the TA meeting? Those general questions are answered in the FAQ, and any specific ones should be sent to the Measure 110 inbox so that we can get you an answer that'll fit your situation. And the next one is, what does a little bit a ways out mean in terms of templates for policies and procedures? And will the date ranges around reporting requirements be pushed out accordingly?
Yes, that's a good question. And I feel like there's maybe a slide upcoming that I haven't just gotten to yet, but the grant agreements state that you have to submit or attest to having policies and procedures for your organization within 90 days of OHA providing those template documents. So that reporting deadline doesn't have a date yet, since we haven't sent out those policies and procedures templates quite yet. But that reporting deadline will be based on our timeline. So there isn't anything that you have to worry about butting up against just yet. And I unfortunately don't have a firm timeline for when those policies and procedures will be ready to go. I know folks are working really hard on them. There are just a lot of moving pieces with 12 areas and making sure that they are all approved by the Oversight and Accountability Council.
Okay, the next question is a request for invites to the TA sessions. And I would just like to ask that if you need invites, if you could send a message to the Measure 110 grants inbox, we can get those all sent out at the same time. And I think that's a question that might come up a few times. The next one, where can I find fiscal reporting information you referenced being sent out?
I believe it should be posted on our website. I'm not sure if anyone on our team has that definitive answer, but I believe the template and some of that information is on our website.
The next question is, are we sending monthly summaries to DHS with the Measure 110? I believe it should say patients we are supporting, since this is an OHA contract and not a DHS contract.
No, you don't have to send kind of any kind of monthly reporting on any client level data or patient monitoring data.
The next question is, did we ever get new budget spreadsheets? Ours was not populated correctly and was told we would be getting new ones last week.
I do know that we have an updated budget fiscal reporting template that should be populating correctly. And I believe that is posted on our website. And if not, Maybe we can also attach that fiscal reporting template along with these slides that we send out to everyone today.
Okay, next question. We were told that TA chat questions would be published in the FAQ. Why do we need to send them again?
Sorry, I'll clarify. We have all of the questions from the TA chat, so you do not need to send them again. We're still working on answering them, and that will be published in a separate data reporting FAQ once those are finalized.
And the next one, where can we find the 12 areas for policies and procedures? And just a note that we will send this presentation out after the meeting.
And I think we have that actually in a few slides. We have that that breakdown. So I'll get to that.
Right. And the next question is about the Measure 110 email. I will drop that again in the chat, and I'll drop it periodically. Let's see. Next question is, the last 3 W through Y counties do not populate in the budget template. It's a comment more than a question.
Okay, well, we can take that back and look into that.
All right. And then the next one is another comment saying that the new spreadsheets were sent out. And that's it.
Okay, thank you, Sydney. Good questions and comments and clarifications. So thanks for putting those in on the chat. We can move forward. So again, just kind of reviewed all of this. Okay, so gathering my thoughts again. As we've kind of touched on, there are some reporting requirements. I have a slide coming up on the policies and procedures. All of the policies and procedures that are required can be found in the Chapter 944 rules. They're also on the next slide. And these are due, like I mentioned, within 90 days from when the templates are received by you all from us. So that clock has not started yet. And I don't have a great sense on when those policies and procedures will be finalized. But I know our team is working very hard on them. The second bucket of reporting information that's required is aggregated client data. As we have discussed in our welcome meetings and during the TA session, we are phasing our approach to collecting client data. And so we are really starting out with some very basic counts of number of clients served, number of services, and basic demographic information to start getting folks ramped up to eventually comply with the Real D and SOGI data collection. And these reports will be due quarterly. As I've mentioned, I know that there were questions in our TA session. We have those. We are working on answering them in a separate FAQ document, and that will get shared along with the reporting link when all of that is ready to go. And we will have that to folks before the end of this month. We also have fiscal reporting that's required. We will look into some of the bugs in the fiscal reporting template that was resent, and we'll make sure that we kind of resend it along with these slides so that everyone makes sure that they have that fiscal reporting template as well. So these are the 12 buckets of policies and procedures that each burn partner must submit. These are laid out by Senate Bill 755 and the Chapter 944 rules. And these policies and procedures will be due 90 days after receiving a template from OHA. So if you have policies around these areas, you are welcome to substitute them in for our template. But for folks who do not have policies and procedures in place, we are going to be providing these templates for you to be able to use or adapt or customize. So the 12 areas are how you all are planning or having policies and procedures around providing culturally and linguistically specific services, culturally and linguistically responsive services, accessibility for people with intellectual and developmental disabilities, accessibility for people with physical disabilities, providing gender affirming and responsive care, providing LGBTQIA Two-Spirit Plus affirming and inclusive services, how to provide patient-centered and non-stigmatizing services and care, youth-friendly and inclusive services, trauma-informed engagement and care, services for parents with minor children, the data compliance, how you're going to collect and report that data that's required in the Chapter 944 rules, and services for pregnant persons when applicable. If you do feel like you have policies and procedures that align or address all 12 of these areas, you can submit those to the Measure 110 inbox. Again, if not, that's totally fine. That's why we're working on providing templates for folks to adopt or use as a starting place. And we should have those soon. And again, you don't have to provide anything back to us until 90 days after receiving those templates. I think I'll pause again there, Sydney, to see if any more questions have come in just about the reporting buckets, the policies and procedures, which aren't required yet. The data reporting, which was addressed last week during TA, and the fiscal reporting, which was addressed 2 weeks ago during TA.
Hey, Kristen, this is Chelsea. Sydney got kicked out.
Oh,
So I'm going to read some questions for
okay,
you.
thank you.
So the first question is, in the budget template presentation, we were told if our budget changed at all from what was originally submitted, we would need to update it on the budget template. However, when I started to fill out the new template, it has a reduced budget total after we make cuts. So should I select no, that it hasn't changed? Also, does the budget template offer an opportunity to shift the budget line items?
So those are good questions. If you all watched the OAC meeting last night, we did present the council with kind of options for how to address budget changes. I think we all recognize that between when you initially created these budgets and now and going forward, that changes will happen. The council voted to delegate some authority to OHA to approve changes within budgets, and we are working on a process for exactly what that will look like for you all, and hope to have that out very soon, because I know I've seen some requests for budget changes already, and we just want to make sure that we're documenting those changes and making sure that they're a part of our record with you all, so that we everyone's on the same page about changes within the budget, within line items, shifting around line items. And so we'll have more information about that very soon. If that was just last night, that is kind of late breaking news. And so as for your budget numbers going down after putting in changes to the template, I think that might be maybe a template bug issue that we can also look into.
Perfect. Okay, the next question says this slide says programmatic reports. So I think it's the previous slide we're referring to. Says the reports are due quarterly, but in the grant agreement 4.2 says every 6 months. Is it not 6 months for client data reports?
The data reports are quarterly. The first one will be due January 15th for any services provided between July 1 and September 30th. And then the second report will be, I believe, due in April for services provided between October 1 and December 31st. So those will be quarterly. And I can't remember off the top of my head what 4.2 is in the grant agreement. So we might have to follow up on that question.
The next question says, sorry if I'm misunderstanding, but want to be clear, when you mention fiscal reporting template, this is a separate sheet from the budget template we are to complete and submit by October 14th.
Sorry, those are the same templates. I think this says fiscal and we said budget, and that is confusing. So I apologize. They are the same template.
This question is regarding the next slide. It says, can some of these be included in one policy?
I think that's a question that we'll have to get back to you on. I think, the goal here is really to make sure that all 12 areas are covered. And so it might be that, with one policy, you are including how to handle multiple of these issues, but I don't want to misspeak and provide bad information. So I will get clarity and we can follow up.
The next question is in regards to that as well, asking how these 12 points are defined. Many of the points are relative to the evaluator. Do we have a standardized definition for these points?
If they are not defined in the Chapter 944 rules, we will have additional information in the policy templates that we provide, but I believe many of them are defined in the Senate Bill 755 and Chapter 944 rules.
The next question states, what specific data are we including in the data reports regarding clients?
I can't remember if we have a slide in here, but I would kind of refer you back to last week's TA session that had the full breakdown of what will be required to be reported on. And maybe we can find that link and either share it when we send out these slides or pop it in the chat.
Next question. So it was my understanding that the initial budget changes could be entered and submitted by October 14th. So that's not really the case. We should go ahead and submit budget as is and wait until the process for budget amendments is established.
Yes. The changes we're trying to capture in the budget template for October 14th are really changes that were made between your originally submitted budget and what was approved by the OAC. If that makes sense. So we want to make sure that we have a starting baseline for everyone with this October budget template.
Okay, there's another budget question coming in saying initial budget and revised budget sheets for leftover funds submitted to OHA were for 19 months. Can we make adjustments to the budget to reflect 18 months?
Yes, that is one of the kind of changes that I think we're anticipating. And again, we'll have kind of that process for documenting those changes very soon.
For planning the remainder of the grant period, has there been an official decision as to whether all M110 grant funds need to be spent by December 2023, or whether there could be any carryover of grant funds past December 2023?
There has not been an official decision made on that question at this time. But it is a topic of discussion, and we will have a decision on that hopefully before too long.
Next question. In the contract, data reporting and number denied, enter the total number of individuals who requested services but were denied or not connected to services. Is this question asking how many individuals were denied from our services that were referred to us 4D? Or is it asking how many were denied that were 4D referred out to the burn? How would we track that if so? And will the burn provide us with updates on our clients that we are referred in?
So I think all of these definitions will be included in some of the more specific data that we send out, along with the data reporting online link. So that question, I believe, will be answered, and that definition will be, I think, a little bit more clarified in the information sent out soon.
Okay, with that, I believe Sydney is back, so I'm going to pass it back over to her to keep going through the questions.
Thank you, Chelsea. I'm so sorry about that. I don't know what happened.
No
The
worries.
next question is there a repository where all this information lives? I feel like it's getting lost in email for me.
We are trying to post everything onto our website, and we are also working on making updates to our website so that it is a little bit easier to find all of these things. But if you have specific things you're missing, you can always just reach out to us and we're happy to resend.
All right. And the next question is, how soon do you expect a process in place for budget amendments? We already know we want to make that request.
We are hoping to have that within the next week or so. We just wanted to wait on the council to make their decision before we move forward, not knowing exactly how they would go. So hopefully within the next week or so.
All right. The next question is just a link to the website, which I'm about to post, and that's all for now.
Okay, thank you, Sydney. And thanks for these good questions. There are just a few more slides. I'm not going to probably spend a ton of time on them because these guiding statutes and regulations are more places for you to bookmark than anything. So as you all know, there are a variety of federal, state, and local laws and regulations that might apply to your work. And so we pulled together these resources to assist in that. Some of the federal regulations are, of course, 42 CFR Part 2 and HIPAA, which discuss privacy and confidentiality. And SAMHSA has links to all of the other federal regulations regarding substance abuse and mental health. From the state side, we have the OHA mental health program laws, harm reduction program guidance that's outlined from our public health division. And then we have our Oregon Health Plan policies that outline state Medicaid rules, and the Oregon Controlled Substances Act, which is Chapter 475 on controlled substances. For local specific codes, you will have to contact your county as those kind of change. But these are really just places for you to bookmark and keep handy in case questions arise over regulations. And this next slide is just again kind of breaking down some of the state level laws, since that is where we come in, leaving OHA. We highly recommend that you subscribe for the Behavioral Health Recovery Report, which is a monthly email communication to help the state's behavioral health stakeholders stay up to date on news from the Oregon Health Authority. So again, these are just links and reference materials for you all to have should questions arise. So moving forward, we are working and constantly tweaking the reoccurring meeting schedule for how we communicate future information. We do have technical assistance meetings every other Thursday from 9 a.m. to 10 a.m. So the next session is next Thursday, September 22nd. Currently, these technical assistance meetings are for OHA staff to provide presentations regarding some of the program requirements to enable successful program administration. There is a separate invite for that. As Sydney noted, please email the Measure 110 inbox if you have folks on your team that you would like to add to those meetings. They are usually filmed, and the YouTube link does go out if you can't make it and want to watch it on your own time. And we are working on kind of future meeting schedules in smaller groups to allow for a little bit more dialogue, information sharing across firm partners, and that kind of thing. So look for more information on that soon. So again, we have some resources. A lot of these are on our website, but the links are also here in the slide deck that we'll send out. Because I know navigating YouTube and our websites can be a challenge. So these are the links to all of the previous office hours and the technical assistance sessions that we've had. We also have that ongoing FAQ document that I referenced, as well as a forthcoming data submission specific FAQ to capture the questions that we are getting. We're also coming up going to be sharing more information on Medicaid, how to bill Medicaid, how to maximize billing Medicaid, how to work with the Oregon Health Plan, and that information will be coming soon. We're also, our social determinants of health team is getting up and running on making sure that we are reaching out to folks with real property purchases or proposed real property purchases. I know some of you maybe have been in touch with them already. They will be proactively reaching out to everybody who indicated that they had real property purchases in their budget to make sure that they record that information and get you what you need. We will also be having more information on the Alliance for Life contract, who, as you know, are currently running a 24/7 emotional support and resource referral hotline. And the future of that contract will also be shared sooner or soon. So we also want to know what topics you're interested in hearing about at future TA support meetings or in the FAQs. Please drop your ideas either in the chat or feel free to email them to us. We are trying to co-create and be responsive to things that have come up. And so we're always welcome that feedback and those suggestions. So with that, that is the end of this presentation. Thank you for sticking with it. Again, we'll make sure that we email out these slides and all of the information I promised to you all today. But with that, I think I will take down my screen and see if Sydney has any more questions that have come into the chat.
There is one question that I believe you just answered. A partner is in the middle of a real estate purchase, and they received an email a few weeks ago saying the policy for restricted deed covenants for real estate purchases would be coming soon. Asked if we have an ETA for that policy.
Yeah, we are having our team start to reach out to people, but please, if you want to proactively make sure that you get connected with them, you can email the Measure 110 inbox, and we will make sure that we make that connection happen sooner rather than later, because I know a lot of people are hopping on buying real estate, and that is so exciting to see and hear.
Then there were two last questions that I did answer about links and presentations. They are not currently shared on the website, but we are sending them out before and after these meetings. If you're missing a link, please reach out to the grants inbox and we will get that sent to you. And we are working on a place on the website for those links. So you won't have to do that. It should be available in the next week or so. So be looking for that as well. But if you need a link or a presentation, please reach out and let us know. And that's all.
Okay. Well, thank you everyone for joining us this morning and for joining us throughout this process. I know that sometimes our answers are, well, we'll get back to you. That's most of our answers, actually, it seems like. So we just appreciate your patience and sticking with us as we get these burns up and running and work to get all of these answers back to you. I really appreciate your patience and your willingness to just go through this with us all. And as always, I just want to express my gratitude for the work that you all are doing and have been doing prior to Measure 110 in your communities. And I'm so excited to just see the work continue and expand. And we will be in touch. Thank you all. Enjoy your Thursday.